Hello everyone, I'm Dr. Joel Schwartz. I'm a chiropractic physician and I practice in Monroe Township, New Jersey. Today I'm going to talk to you about a very important point but overlooked point of thyroid diagnosis and treatment, and that is the evaluation and management of a disorder called Hashimoto's thyroiditis. And that is spelled this way, Hashimoto's thyroiditis. Hashimoto's is actually the most common form of low or hypothyroid function that we have in the United States today. Now, years ago, the most common problem with hypothyroid was a lack of iodine. But today, with our high salt diets, iodine is really not that important, and Hashimoto's is much more important. Now, Hashimoto's is actually what is called a disease of autoimmunity. What does that mean? Well, disease of autoimmunity means the immune system cells, in other words, the white blood cells of your body, are actually attacking, in this case, your own thyroid gland. Okay? That may sound a little bit strange to you, but it's very common. There are many other diseases, rheumatoid arthritis, multiple sclerosis, type 1 diabetes, celiac disease, that are also autoimmune diseases where your own immune system is attacking a particular tissue in your body. For example, in the case of rheumatoid arthritis, the immune system is attacking the joints. In the case of multiple sclerosis, the immune system is attacking the covering on the nerves. Okay? So why is it important that you know that Hashimoto's is an autoimmune disease? Well, it's important because whenever you have a disease, you want to treat the actual cause of the problem. That makes sense, I'm sure, to you. If you treat the cause of the problem, you're going to have better results and your health is going to improve over time. So let's talk a little bit now about the medical treatment of Hashimoto's and the medical diagnosis of Hashimoto's. Now, the medical treatment and diagnosis of Hashimoto's really doesn't exist. Most often, medical doctors will not test for Hashimoto's. And how do you test for Hashimoto's? You test by doing a specific test called thyroid antibodies. You can tell if someone has Hashimoto's somewhat by their signs and symptoms. But bottom line, if you really want to know, you have to run the test. And that's what we do in our office. We run a thyroid antibody test when we think your thyroid is out of balance. Okay, so we have to run thyroid antibodies. Now, signs and symptoms, just to tell you a little bit about Hashimoto's, the signs and symptoms wax and wane. They get better, they get worse, okay? And during the courses of that, your thyroid medicine, you'll probably be on Synthroid or levothyroxine, will have to be constantly adjusted. So I'm sure if you have this problem, you're familiar with that. You're going to the doctor constantly to have Synthroid or levothyroxine or other thyroid medication adjusted so that your TSH gets right into the right level. Well, that's good. It's good to keep the thyroid running by giving it a replacement, but it's still not treating the cause of the problem. You may need to have thyroid replacement, but you also need to treat the cause of the problem, and that's the autoimmunity. So if you have Hashimoto's, your immune system is attacking your thyroid, and your thyroid's being slowly destroyed. And if you're getting the medical treatment, you're getting replacement of your thyroid tissue with levothyroxine or Synthroid, but you're not treating the autoimmunity. So your thyroid gets worse and worse over time, and your Synthroid has to be adjusted over time. Okay? That's, in my opinion, not a great way to do it. There's other problems as well. If you don't treat the autoimmune part of Hashimoto's, you're going to have other problems. Because Hashimoto's is an autoimmune disease, people with it will also have problems with other tissues in their body. For example, you may have the typical thyroid brain fog or depression. And in this case, the thyroid, which is being attacked by the autoimmune system, is causing, lack of clarity. In this case, you're going to probably end up going to a psychiatrist and end up getting Prozac or some other antidepressant drug. So you also could have problems with your GI tract, like irritable bowel syndrome or GERD, gastroesophageal reflux disease. And this means you're going to have to go to a gastroenterologist, okay, get another drug. You could have problems with your blood sugar. And you may have to go to an endocrinologist to get metformin. You could have problems with your cholesterol or triglycerides, and you may have to go to a cardiologist and get cholesterol medication like Lipitor. But why would you have to get all these other medications? Because the thyroid is so important in all body functions that when the thyroid goes down and is not being treated adequately, okay, other symptoms are going to show up. And typically what happens is in the medical HMO treatment of the disease, you get thyroid replacement therapy, and then you go to get other drugs for all these other problems, okay? Yeah, that's one way of doing it, but you're just over-medicating yourself and you're not really treating the cause of your problem. The cause can be effectively and safely treated with nutritional, lifestyle modifications, nutritional supplements, and neurological treatments called brain-based therapy. We do all of these in our office. They're very safe, and they treat the cause of the problem, which is most important. So, in conclusion, let me just say a couple other words. If you have an autoimmune disease like Hashimoto's, you can end up having other autoimmune disease like celiac disease, as I told you, rheumatoid arthritis, multiple sclerosis, other things. You really need to treat the cause of the problem. Sorry I'm reiterating this so much, but it is important. So if you would like more information, at the end of this video presentation, you can click on, or not click on, you can type in a little address. It'll get you to our website, and you can order the free thyroid DVD, which lasts about an hour long and goes into Hashimoto's and all the other aspects of holistic natural thyroid care that are important. You also can watch other thyroid videos, if you'd like, that I've made. So thanks very much for watching, and hope to see you soon.